So in this lecture, we're going to look at the anterolateral abdominal wall. So on the screen, we can see we have the torso of a human which has had the skin removed to see the musculature and underlying fascia or fibrous tissue that is within the trunk. Specifically in this lecture, we're going to look at a series of muscles that make up this abdominal wall, look at internal oblique, external oblique, transversus abdominis, and rectus abdominis. We'll also look at their attachments, where they originate, where they insert, and what function, what movements they carry out, and what important roles they have for the correct functioning of the abdomen. We'll also look at some aponeuroses, which are the flattened tendons of these muscles, and we'll look at an important structure known as the rectus sheath. Throughout the lecture, we'll look at some important neurovascular structures, the arteries, the nerves, the veins of this region. And then very briefly, we'll introduce the inguinal region and specifically the inguinal canal. And in the next lecture, we'll look at this in a lot more detail. So let's start off with some basics of the anterolateral abdominal wall. Here we can see from anterior to posterior, we can see that most anteriorly, and what you can see when you take your shirt off, is the skin, and we have this outer layer of skin which we can see here. And deep to that layer of skin we have some subcutaneous, some fatty tissue, which we can see in this layer here, which is immediately deep to the skin. And then in the more lateral aspect of the abdomen, so not where we spoke about the rectus abdominis muscles in the previous lecture, but more laterally, we find we have three layers of muscles, which we can see here, 1, 2, and 3. These are our oblique muscles and our transverse abdominis muscles. We then find deep again before we get into the viscera of the abdominal cavity, the gastrointestinal tract, which is depicted here. We have a couple of layers which are within this one line here called transversalis fascia. That's an important layer when we look at the inguinal canal. And then finally the peritoneum, which we'll talk about in detail in subsequent lectures. So this is just the basic outline of a section through the abdominal wall from superficial to deep. We've got fat, we've got skin, we've got muscles, and we've got important membranes before we get into the viscera.